Thank you, Dan. My name is Amelia Tollefson. I am a nurse practitioner. I work at Transform Diet and Wellness Center, and we are just down the road on Capitol at the corner of Georgetown and Capitol Drive, so less than 10 minutes away from here. And I've been working there, like you said, for about 3 years. And we offer the HCG Diet Protocol, primarily for weight loss and healthy eating, and then also bioidentical hormone therapy, which is a completely different topic. But if you have any questions about that, I'd be happy to answer those as well. All right, first of all, we all know that there is an obesity epidemic in the United States, and it's all over the news. What exactly is obesity? So it's defined as a BMI, or body mass index, of 30 or higher. That's it. That's what obesity is. So, you know, when doctors take a look at a patient or any health practitioner, they might say, you know, what's their BMI? If it's over 30, check a box, and that is your diagnostic code that you are considered obese. Your body mass index simply is a measure of an adult's weight in relation to his or her height, calculated by the adult's weight in kilograms divided by the square of his or her height in meters. So boiled down, it's how much you weigh versus how tall you are. So you can see height and weight, and that's all that's factored into your BMI. But what you weigh is a lot more than how tall you are, or I'm sorry, how healthy you are is a lot more than just your height and weight. And you can see we've got 3 dogs here. Now, a bulldog actually has a lot more fat and probably weighs a lot more than this dog, which is a Saluki. Neither of these dogs are unhealthy. They just have different frame size and different body compositions. So it would be unrealistic for you to say, bulldog is unhealthy, he should look like this. That's just not how they're made. So frame size, it has a huge thing to deal with your BMI. Someone who has a lot more larger bones, more muscle mass, they're going to weigh more than someone who has a smaller frame size. So they might be categorized as heavier, BMI is higher, when actually it's just that they weigh more and not be unhealthy at all. So taking a look at your lean tissue, your muscles, versus your fat stores. Gender has a lot to do with it. A man usually weighs more than a woman. How old you are has a lot to do with it. Your activity level. Are you someone who sits at a desk job, or are you a lumberjack who's very physically active throughout the day? The quality of your food. In the United States, we're pretty lucky that we have a pretty varied, readily available food supply. People in other areas are not as fortunate as we are. Ethnicity and genetics play a large role in your body composition. Endocrine and hormone imbalance. You often hear that someone has a glandular disorder and that's why they're heavy. That is actually true. There are some endocrine disruptions that can really affect your height, or I'm sorry, your weight, despite how healthy you're eating. And then also a much better look at general health is your biomarkers. So your blood pressure, your cholesterol panel, your heart rate, how your organs function at a certain height and weight. So not just a BMI. A BMI doesn't really tell us anything. You have to take all these things into consideration. So what is quote unquote normal or healthy? The amount of fat that needs to be on your body for you to live is about 10 to 13% for women, and then 2 to 5% for men. This is absolutely essential. So the whole term, I want to be fat-free, you would not be alive if you were absolutely completely 100% fat-free. These are where people who are doing figure competitions, or the bodybuilders, where you can see every little vein in their body and every little striation of muscle tissue. Not a very realistic goal, and truly not very healthy, because you're getting very dangerously close to too lean to function well. Athletes are generally 14 to 20% for women, 6 to 13. This is like your Olympians who look incredibly lean. People who are fit, usually 21 to 24% body fat for women. someone who's kind of acceptable, maybe like I have a few pounds to lose, but nothing I would, worry about, 25 to 31%. And then generally obese is 32%. So taking a look at how much body fat you have stored versus how much lean tissue you are using. A few statistics about obesity and overweight people in the United States. Almost a third of our adults in this country and only 17% of, and almost 17% of our youth were obese in 2009 and 2010. There was no change in obesity between adults and children in 2008 to 2010. Obesity didn't really change between men and women. And adults 60 and over were more likely to be overweight than younger people. So you can take a look at the trends, and I don't know if you've seen this before, but back in 1990, you can look at the little thing here. Wisconsin, 10 to 14% of our population was considered obese. 10 years later, 15 to 19%. So it about doubled. 2010, which was about 5 years ago, we got into the 25 to 29%. So you can guess in another 10 years, in 2020, yeah, and you can kind of look at where
and Michigan.
The green belt. Colorado has usually stayed behind, but it's a very scary prospect when you think about children growing up that maybe in a couple, when they're adults or even older adults, that over 50% of our population will be obese. So what are some of the health risks? Coronary artery disease, or people who are prone to heart attacks, high blood pressure, stroke, type 2 diabetes. Does anybody know anyone with type 2 diabetes? It's very, very common. About 50 years ago, almost none of you would have raised your hand. It is increasing in prevalence, and most of it is due to how we eat more than type 1 diabetes, which is an autoimmune disorder that affects your pancreas, which produces the insulin. Abnormal body fats, elevated triglycerides, and LDL. So this is your cholesterol panel. Recent studies are looking at people who are qualifying to be on cholesterol-lowering medication. There's one study that suggested everybody should just go ahead and take it because we all have terrible cholesterol levels, and that's also a kind of scary thought because it's not a vitamin or mineral or something that we could benefit from. It's to prevent us from getting these things. Metabolic syndrome, this is a condition that's kind of sandwiches together a bunch of things. So increased abdominal girth, so our beer belly. Dyslipidemia, which just means poor cholesterol counts. Having high blood pressure, elevated fasting blood sugar. So if you've ever had a baby, when they test, they're testing for when you haven't eaten, how high is your blood sugar? And then it can lead you to increased risk for cancer, specifically colon, breast, endometrial, and gallbladder cancer. Risks are elevated when you are obese. Osteoarthritis, sleep apnea, an obesity hypoventilation system. So what this means is that you're so heavy that your body can't breathe very effectively at night because you can't lift and expand its lungs. When parents are obese or overweight, they're at higher risk of having obese or overweight children and pets. So you can see even things that the norm, a lot of these things, lower life expectancy, joint problems, heart attacks, depression, these are all very common things. And not every single one of them is only due to someone's weight, but a lot of them are linked. This is, I found kind of interesting. Back in the 1920s, when Coca-Cola first started marketing, the size was 6.5 ounces. So this is what you would get at your little drugstores and serve in the bulb glasses. Now they introduce a liter. And people, and I'm not excluding myself, can easily down one of these or even several in a day without really thinking about it. And you can see it's not unusual to see a child who's overweight or obese. So there's different theories on why we get fat. One of them is the set point theory. So that means what it is you have a certain weight where your body likes to stay. And you might gain a little bit and you might lose a little bit, but there's a certain point where your body will kind of adjust itself. There's the fat cell theory, which says that when you're born, you have a certain number of fat cells and they'll either grow or shrink, but it's kind of preset. So if you're born with lots of fat cells, you are predestined to get fat as you age. If you don't have very many, you'll be thin. That's another theory. There's the energy balance, and this is probably the most common. Calories in, calories out. If you want to lose weight, just eat less and exercise more, and the weight will come off. Which works really well, I know, for a lot of people. We actually, at Transformed Diet, we kind of ascribe to an alternative hypothesis that it's a growth disorder. So there is a hormone effect, and what you put in your body affects how your body's going to process these things. So if you are putting a lot of things in your body that are favorable to putting on fat, that is what you're going to do. And if you change your eating habits and your lifestyle so you are in a hormone about to shed fat, that's what will happen. So HCG. So the HCG protocol was developed by a British endocrinologist in the 1950s. His name is Dr. Albert T.W. Simeons. He was born in London in 1900, and he was actually a very accomplished physician. He wasn't, you know, a quack kind of doctor. He actually helped you develop the use of an injectable medication for malaria. He received the Iron Cross of Merit for his achievements in the field of medicine by the Queen of England. So actually a very smart man. He developed the HCG Diet Protocol. So what the protocol is 125 units of sublingual HCG. It can also be given in an injectable form. To be used for 25 to 80 days, 0.5 to 2 pounds average weight loss per day, targets fat storage versus structural or insulating fat. So the cellular structure, we're actually pretty much primarily composed of fat and protein. Now, your brain is mainly made up of fat. That is not the fat that most people want to metabolize when they're losing weight. They don't want their brain to shrink. What we're really looking at is this kind of fat, the more vanity fat. HCG really targets that because that is fat in this storage form versus the structural, or we have fat around our heart, which really protects it and insulates it. Also don't want to metabolize that. So what is HCG? Human chorionic gonadotropin is the long version. HCG is obviously much easier to say. And here is it in its molecular form. So it's a natural hormone that's produced by the placenta of a pregnant woman. It's actually an FDA-approved medication, and it's FDA-approved for the treatment of fertility or for people who have delayed puberty. It actually works at the level of your brain to help induce your reproductive organs. The dose that is given for the treatment of fertility is much, much, much higher than the dose that we use for fat loss. So you don't need to be worried that you are going to become extra fertile when on the HCG protocol. Most people are not trying to get pregnant and losing weight at the same time. So you don't need to worry about that. But what HCG does is that pregnancy is a very unique metabolic condition. So I use this example a lot. Have any of you ever had the flu and you didn't eat for a week? Did you lose weight? You probably did because you weren't eating and drinking very much. and you lost weight. After you got done being sick, did you feel great and have lots of energy? No. You usually lost fat in places that you didn't necessarily want to, like your face or your neck, and not so much here, and you were drained. A trip to the bathroom can really wipe you out. So unlike a starvation protocol where you get very weak, you get very hungry, you need a lot of rest, you feel very, very unhealthy, HCG kind of protects against that and really metabolizes stored things. So similar to when a woman is pregnant, your body will prioritize the growth and development of that infant. So if a woman doesn't have access to food or is too ill to be consuming a lot of food, let's say she has terrible morning sickness, that baby's growth and development isn't necessarily compromised because it can use mom's stores. So this is just, there is a little bit of a controversy that the FDA has not cleared HCG in the use of weight loss per se. However, and this is not illegal, we use it as off-label. So here's another example of off-label off-label use of a medication. Aspirin is used sometimes for people for pain reduction. It's also used after people have heart disease because it helps thin the blood. Bayer aspirin wanted to get FDA clearance and that they wouldn't clear Bayer aspirin as that. So, but do people take aspirin after they've had heart disease, and doctors recommend it, and there's nothing wrong with that. It's just an off-label. Similar to using a birth control pill if you've had your tubes tied because you want to regulate your menstrual cycle, off-label prescribing. The weight loss industry, unfortunately, is very prone for people who are scamming. And HCG, like I described earlier, is naturally produced by the placenta of a pregnant woman. So nature makes it, nobody can put a patent on it. So you can look at an over-the-counter thing and it'll say HCG, and because there's no trademark on HCG, it can mean anything. So a lot of people say like, oh, I saw this HCG at, you know, my local drugstore. Why don't I just take that? And Dan can, I'm sure fields lots of phone calls from this. Legally, this cannot contain HCG if it's sold over the counter. It must be obtained by a prescription. So what I tell people is, would you trust your birth control pills or your heart medication to something you found over the counter? Probably not. So don't trust any of these things, because legally, if it does have HCG, it does need to be refrigerated. If you see it over the counter not refrigerated, it wouldn't be potent anyway, even if it did contain HCG. Also, that company would be in a lot of trouble because it's illegal to do that. So just an FYI. A few things about how HCG works in your body. It mobilizes peripheral fat. That's the storage form we were talking about in the generation of ketone bodies by the liver. In 1970, they administered HCG to rats and it enhanced lipolysis. So what lipolysis means is the destruction or the destruction of fat, and increased lipogenesis in the liver, so clearing the liver of fat. They found in 1972 that it concentrates in the hypothalamus. Before they thought, because they were originally studied and found it to work on reproductive organs, that it actually, mechanism of action was right at that level, but it actually works at your brain. They also did find an HCG receptor in fat cells. In 1973, Asher and Harper conducted a controlled clinical trial looking at HCG versus people who were on placebo, and that they found that the HCG group lost an average of 19.96, or almost 20 pounds, and the placebo group lost 11.05. But even more significant than how much they lost is the HCG group experienced less hunger and improved well-being. So kind of what I was talking about when you don't eat because you have the flu versus you don't eat because you're not hungry and you're feeling very well. And systolic and diastolic blood pressure dropped by at least 5 millimeters of mercury with the HCG. So our diet protocol, we take the sublingual HCG twice daily. You get 2 days of fat loading, no added sugar or fat. So what I usually tell people is your best bet is if it comes in a carton or a package or any kind of processed food, just skip it because they add sugar and starch to everything. It's really kind of amazing once you start picking up something and taking a look at the label, how much sugar they're adding to things. I was making chili, stewed tomatoes, they have added sugar. I have no idea why. It's not like anybody has an attack and munches on stewed tomatoes. There's no reason for it, but they were in there. It was alarming. You can have unlimited amounts of coffee, tea, water, any non-calorie beverage. I like to use when people are on HCG protocol is kind of, this is very illuminating in how you eat and drink because a lot of things we do by habit and we don't really realize all the things we're putting into our body. Like I said with the soda, it's really easy to drink a liter of soda and not realize it. Similar to like, oh yeah, I only had like a handful of popcorn when really we're doing this for a good 20 minutes. It's a good time to take a look at some bad habits that we might have acquired over the years and nip them in the bud. So while a Diet Coke may not necessarily ruin anything as far as weight loss, is it the healthiest thing that we could be drinking? Probably not. Twice a day you get a serving of fruit. The original protocol called for only apples, grapefruit, berries, and oranges. At Transform, we've kind of looked at a few other options that it isn't necessarily as restrictive. Unlimited amounts of low carbohydrate vegetables. So salad greens, tomatoes, onions, radish, cucumbers are a few examples. These are things that are very nourishing and they're very filling and they're not things that we're necessarily prone to overeat on. So unlike popcorn, where we can continue to do this, I don't think I've ever seen anybody say they can't stop eating cucumbers. I mean, really, after a while, you're like, okay, enough cucumbers. They're delicious, but I've had enough. And listening to our body's hunger and full signals is incredibly important. Just like we listen to, well, we try to, listen to our sleep and awake cycles. We don't stop and take a nap in the middle of the day when you're not tired. Now, if you're chronically tired, that's another thing. But, but we often find ourselves eating when we're not hungry. Oh, that pizza smells really good. Or, oh, I'm sitting right by this, the waiter just brought around the dessert tray. I might as well. Everyone else is doing it. It's really easy to do that. Twice a day, a serving of protein. Now, everybody's going to have different protein requirements. If you're very physically active, if you're a really big person with a lot of body mass, you're going to need more protein. Protein is another thing that people tend not to overeat, and it's pretty difficult to put on more body fat by overeating protein. It's not impossible, but it's pretty difficult. And usually I find people who are overdoing the protein are usually taking some sort of protein supplement because eating 2 16-ounce steaks is really difficult to do. But the creme brulee after the 16-ounce steak is really easy, and it's one of the things where life is really just not fair. So we talked about what is on the HCG protocol, what is not. No added sugar, starch, or oils, and like I said, they sneak it into everything. It broke my heart when I took a look at imitation crab. I'm like, oh, it's just fish. And the second ingredient is sugar.
Oh, really?
It's really bad for you. It was so sad because I was thinking I was being really healthy. I'm like, oh, I add this to salads. I like to freeze it. It's so good in omelets. This is great. And it's really like fish candy. It's
Oh my God.
so sad. Yeah, it is, pretty much. Like I said, staying away from any processed manufactured food or drinks. The food industry has done a lot of research and put a lot of money into making their food taste super delicious and very addicting. They are not your friends. They don't want you to take a few bites and put it away. They want you to, oh my gosh, did I just eat that whole box of Girl Scout cookies? Should get another box, right? No alcohol of any kind. High glycemic fruits and vegetables. Now, high glycemic just means they have a higher amount of naturally occurring sugar and starch. And these aren't necessarily very unhealthy for you. So a banana is one thing that I usually suggest people limit. Do I think that this country has an obesity epidemic because we eat too many bananas? I honestly kind of doubt it. But when you are in weight loss mode, you do need to eat a little differently than when you are in weight maintenance mode. So I'm not saying no bananas ever for the rest of your life. Has anyone ever seen that internet ad on the side where it says like 5 belly fat foods? Yeah. And they always have the banana on there. Yeah. No grain products of any kind, simply, again, because they have a higher amount of carbohydrate starch in them. Again, does this mean that they are 100% gone from your diet? Not necessarily, but this is, again, this is where life is not fair. My brother could eat an entire pizza and lose 5 pounds. Should pizza be a universal food for weight loss because my brother can do it? No, unfortunately, it's not. There's some people, a banana might be a big problem for them based on what their metabolic situation is. And, you know, when you have ambitious goals, you need to eat a little bit more restrictively and finding out which foods are fine for you. What I might be able to eat and lose weight or maintain my weight might not be the same for you, but really figuring that out so that you can go to a restaurant and enjoy your life. Cheat days are not included on the HCG. I know a lot of places they talk about that. How I look at cheat days is you're making a choice, and that is fine. Sometimes that piece of cake is absolutely worth it. State fair. Do I have a cream puff? I sure do. Do I take the 6-pack home and eat cream puffs for the next week? No, I try not to. It's a treat. Treat it as such. Move on. Exercise is kind of a little tricky area, and I don't want it to sound that I am anti-exercise because I absolutely am not. But what I really want people to understand is that exercise is really more of a building phase. What are you doing? You are building muscle. You're increasing your cardiovascular and your heart rate and your respiratory rate. So you're building things. Those things take energy. And if you want to maintain that, you need to be eating more energy. So if you're simultaneously trying to build yourself up, but reduce yourself, your body can't do those two very efficiently at the same time. So that's where people get very frustrated because they're killing themselves at the gym and they're eating next to nothing and the scale cancels itself out because it will lower your metabolic rate to compensate. Like, I can't grow and build at the same time. So what will it do? Send you signals, give me more energy. So you get hungry. And when you say, no, I'm not going to eat because I'm on a diet and I want to lose weight, what happens? You get very cranky and less energy. And then ultimately you fail. And then all of a sudden you're like, oh, I was doing so good. And then ice cream came along and wasn't working for me anyway. So what I usually say to people is if you are currently in an exercise regimen, that's great. Your body is probably adapted to doing this. Keep it up, but really listen to your body. If you find that you are hungrier despite eating all the low glycemic fruits and vegetables and all the protein, you might need a little bit more carbohydrate. If you do that, you might not be losing weight as quickly, but your body really needs it.
I have a question.
Yes.
What if you're doing like yoga? What if that's
I think yoga is like one of my favorite things because it can be as intense or as not intense as you'd like it to be. Walking is another one, but I did have one patient who she was a competitive swimmer in college, so she always liked to swim. She was in the middle of doing HCG, and she's like, I was so glad I was by the end of the pool because all of a sudden I got really weak and I didn't think I was going to make it. So you can really get yourself into some serious trouble if you try to push yourself beyond. So keep active, but if you're, now is not the time to train for a marathon when you're trying to lose fat.
But it doesn't affect your weight loss if you're exercising.
It actually can, because when you are using a lot of muscle, so let's say that you and I go running. Have you ever noticed that you are sweating? You're actually losing a bunch of water, and a bunch of extra blood is going to using those muscles. So it is, and it's trying to grow them, be bigger and stronger, so it actually can stimulate your appetite. You actually need more energy.
So it's more about appetite than actually physically affecting your loss.
When you're exercising, and we could talk for a long time about this, I'll say is like, remember at that point you're in a building phase. So if you're not taking enough energy to build it, your body will stall out its metabolism, say stop building, like keep things, and actually might start storing things up because it doesn't want to run at a deficit and hurt itself.
Okay, interesting.
So it kind of can. Now that's to say, like, I'm sure there's people who said, all I did to lose weight is I didn't change what I ate at all and started running. That actually might work for some people, but for the majority of the people, it doesn't work as well. I alluded to this earlier, or actually complained about it vigorously for earlier, what the hidden sugars in your food. So you, and this is where I feel very badly for people who are trying to watch their sugar, or someone who's a diabetic who only is allowed a certain amount of sugar based on how much insulin that they are getting. So you might, take something like jelly, a little packet that you get at a restaurant, 19 tablespoons of sugar in a packet of jelly. That's the high fructose corn syrup, which is actually like several times sweeter than table sugar. So you'd think they use less, but they don't. They actually use more. So someone say like, oh, one little thing of jelly won't hurt you. It actually can be incredibly damaging. Same with things like ketchup, barbecue sauce, mayonnaise. It is very difficult to find mayonnaise that does not have sugar in it, and it doesn't taste sweet. It's amazing. So I'll go through this really quickly, but how does your body utilize energy? So you've got three basic components. You've got your carbohydrate, you've got your protein, and you've got your fats. And like I said, your body is primarily made out of fat and protein. So when your body ingests fat and protein, most of that does not go into energy supply. It goes to building and repair. And your body is constantly building new cells, so it needs that as basic building blocks. What your body will do is use carbohydrate, which in its simplest energy form is called glucose. So every single cell in your body can use glucose as kind of like the gasoline to keep things going. That is perfectly fine. That's how we're built. There's really nothing wrong with it. However, when you have an overabundance of the energy supply, it has to go somewhere. If your cells say, I don't need that much sugar, what happens? It goes from glucose, it goes through a chemical reaction. It's called glycogen. So glycogen is stored in our liver and muscles, and when Kathy and I are running 5 miles, that's actually what's keeping us going. So if you've ever known any distance exercisers where they say, oh, I've hit the wall, what that means is they've run out of glycogen, and that's why like people who are doing exercises for a long time actually have to refuel themselves because they've run out of a carbohydrate. Your brain is the primary organ that absolutely must use glucose for energy. So that's when people talk about, oh, I have low blood sugar or I need to eat something. Your body is kind of going into crisis mode because the brain is one of the most important organs and your body is designed to protect it. So you might feel faint, you might not think very clearly what your body's doing. You will experience intense hunger, and it's usually for something that is very rich in carbohydrates, like crackers or cookies or chips or whatever it is. What the principle we're doing here is limiting this and forcing your body to say, okay, I'm not getting as much carbohydrate. My brain actually needs carbohydrate, so we're going to conserve this. We will start taking that stored energy, put it through a chemical reaction, and it's a ketone body. Your body can actually use ketone bodies as fuel instead of carbohydrate. It will retain as much carbohydrate as it needs for the brain, but the rest of the cells will use fat for energy. And that is a process called ketosis. Very different than diabetic ketoacidosis, which is a very dangerous, life-threatening condition. Dietary ketosis is actually something that most people do as they sleep. You're not eating constantly as you're sleeping, your body is still functioning. Interestingly, your body, when it doesn't have enough carbohydrate that you're taking in, can get carbohydrate from protein stores from your muscle. So that's actually what's happening when you're sick. Why are you not hungry when you're sick? Is it because your stomach is full? No, it's because your body says, like, I do not have the energy. I don't want to be wasting energy taking in and digesting a whole bunch of foods. Turn that person's hunger off. I'll use what I've got. But your brain, and actually you have increased energy needs, and your body doesn't want you to be wasting a bunch of energy, so it turns your energy off. You sleep for a week. It feeds off itself. And that's why you are incredibly weak after, and you can usually say, like, my legs are like jelly because I've been sick for a week. Not because you didn't use them, because your body broke it down to get carbohydrate to feed your brain. So it's actually kind of cool how we're designed, and kind of unfortunate how we sabotage that, because the minute you have, you've been burning fat for energy, you're feeling good, the minute you take in too much carbohydrate, your body flips and starts burning carbohydrate for energy. And when that gets low, you kind of have to go through that uncomfortable process of, like, where's the carbohydrate? Come on, we're eating a lot of that. Now I have to do this. It can be a bit of an adjustment. So, ketosis, it's a byproduct of fat metabolism, very different, like I said, from ketoacidosis and type 1 diabetics. Type 1 diabetics lack insulin, which is the hormone that carries the glucose into the cells. So what they have there is they've got lots of carbohydrate for energy, but no way to get it into the cells. So you have a very high concentrated amount of blood sugar, no insulin, they get really dehydrated. It is not dangerous to liver, kidneys, or other organs like diabetic ketoacidosis. You will have increased water demands. The process of fat metabolism is a process that actually dumps a lot of water. So that's usually what happens when, your first couple weeks of trying to lose weight, you're like, oh, I lost 10 pounds and it wasn't even that hard. That's usually water. And you should be replacing that. It actually decreases your body's cellular need for glucose. Your brain actually always has the same need for glucose. The amount of glucose that you need to get through the day is astonishingly low. It's about 20 milligrams. So that's like an apple. The amount of sugar in an apple, maybe even less than an apple, is enough to get by for the whole day. Grams, I do mean grams. I'm sorry. Thank you. What did I say? Milligrams? Okay. Yeah, I'm sorry. It is 20 grams.
What is that? Is that like Jello? Or what is it?
Your body is able to convert normal glucose metabolism easy. So you, right now, if you are primarily a carbohydrate burner, which there's nothing wrong with that, that is, we are designed to be like that, most of your cells are geared for that. So that's why when you flip to try to be a fat burner versus a carbohydrate burner, it can be a little uncomfortable. Does that mean it's unhealthy? It actually doesn't. If you're not used to running and I made you go out and run 3 miles, would you feel very good? No. Does that mean it's unhealthy for you? Not really. It's just taking a while to get used to it. Do it for 3 months, you will not find running to be very difficult. Your body will adapt. I kind of went through this a little bit. This is the whole thing of how they break down and how that your body can use carbohydrate, fats, and proteins for energy. With the ketone bodies, with the carbohydrates and the proteins, protein can actually turn into carbohydrate, fuel for energy. So you go through the HCG protocol, and then what happens? This is kind of the swan song of anybody who's gone through a diet. I lost the weight, I felt great, and then it came right back on, and then some. And unfortunately, that will happen. Your body is amazing in how it can adapt. So when you have a certain habit, it creates a pathway in your brain. And your brain is always going to remember that you used to do something. So if you are not 300 pounds, it is not hard for you to not be 300 pounds. But if you were 300 pounds and worked really hard, lost a bunch of weight, and got to, let's say, 150, it's always going to be easier for you to return to 300 pounds because you once were there. So you can't say, oh, I've reached my goal weight, I'm done, I can enjoy life again and eat the things. No, your body's going to be like, great, let's go back. Here we were. So it usually takes about 2 to 3 weeks for your brain to really understand a new habit. So if you were someone who was used to drinking liters of soda every day, your body is going to be very used to doing that. You stop doing that, your body will adapt and adjust. It always gets easier. But what you want to really make sure that your body doesn't quickly return to your previous state. You want to just avoid sugar and starch for a little bit longer. And this is where I talked about with the bananas. You could probably eat a banana, but really, are you the kind of person where this is causing an issue for you, or are you someone who can handle this safely? Try it, step on the scale, see what happens. We usually have what we call your whoa number. So you get to, you transition off the HCG, and let's say your ultimate goal weight is 120 pounds, and you started at 180 and you got to 150. You're not at your goal yet, but 150 is kind of where we're minimally want to stick to. So let's say that it's state fair time and you have a cream puff because it's state fair and they're really good. Step on the scale the next day. Did you gain weight from that one cream puff? If you did, that means your body is not able to process that much carbohydrate throughout the day. And then you can say like, okay, state fair comes around once a year. I really enjoy the cream puff. I don't care. I'm going to consider it as a treat and then go back to my normal thing. Or you can say, you know what? I worked really hard. I don't want to, they're really not worth it to me. No more cream puffs whatsoever. I'll pick a different treat that I know my body can handle. Or you might say, I am cream puff queen and I love them and I'm going to eat them for every meal and I don't care. Then you have to say, you know what, my goal originally was 120. We're going to keep it at 175 instead of 150 because I refuse to give up my cream puff. And I know that sounds kind of silly, but there's a lot of people who are like, I'm not giving up my 3 glasses of wine a night. That's a deal breaker for me. And then that's fine. You're all adults. You have the choice of what you put in your body. But then you also have to be realistic and say, all right, if I am going to be a little 10 pounds heavier than I'd like to be because I want to indulge in this thing that is causing weight gain, so be it. That's my choice. And this I'm talking about, identifying trouble foods or triggers. My husband's really funny because he doesn't think he eats when he's not at a table. So he's like, I haven't eaten anything today. I'm like, what are you talking about? Like, you just had a bag of chips. And he's like, oh, well, I was, walking around and working while doing that. So he doesn't count that food. But that is very easy to do. Like how often you walk by, pop something in your mouth, so, finish what the kids didn't eat. It was someone's birthday, you had a piece of cake at work. It's really easy to forget about foods. Also, there's some people, and I'll tell you what my trouble food is: brownies. I do not just eat one brownie. I don't. And I know that. And I don't, I have the pan, and I'll cut along the row to even it. It's not like a piece. I'm not eating a whole piece of brownie, but I'll continue to slice. And before you know it, I've eaten half a pan of little even out slices. And then it gets uneven, so then I'll have to even it out again.
Fix that, right? Yeah.
And I know I'm doing it. So you know what? Guess who does not have brownie mix or cocoa in my house? because I know this is a problem for me. And I am not strong enough to walk past that brownie pan and not even out another, you know, centimeter long. It's so silly. And I know, but that is my trouble. And so really being honest with yourself. I had a patient who liked to keep a candy jar at her desk, and she's like, oh, well, it's really enjoyable for other people. And I'm like, are you eating the candy? She's like, well, yeah. So I'm like, why would you put something that you know you enjoy and you know right in front of you? Right. Don't make it hard for yourself. You also really want to monitor your weight and measurements every day. Eventually this will get easier, but especially with the advent of yoga pants or stretchy things, they are so forgiving. You can put on 10 pounds and not, oh, my pants still kind of fit. Really keeping on top of weight and measurements that, you know. I might be the only one who does the yoga pants trick, like elastic waistbands. Part of the protocol is what's called the correction day. So let's say that you had a ball at State Fair or whatever it was, and you did gain a little bit of weight. Is your life over? No, but you do need to do a correction day. So when you get more than 2 pounds over, and that's, you know, you were at your set point and then you've hit the whoa, more than 2 pounds, that you do a correction day. You'll lose the 2 pounds. You'll take note like, okay, I had a cream puff and a donut and 4 brownies at State Fair. That was too much for me. I'll keep that in mind, that those are things that cause weight gain for me.
What is the correction day then? What do you eat that day? What is that look like? Is it the apple day?
It's not the apple day. It's actually a day of eating pure protein. So what you're going to do is eat 0 carbohydrates throughout the day. You can have like a apple or a tomato. But what you're doing is actually flushing out the extra water, because I'll tell you, it's physiologically impossible for you to put on 2 pounds of fat in 24 hours. Impossible. Same as it is to lose 2 pounds of fat. If you really lost 2 pounds of actual fat, you would probably drop about a size, because fat is not very heavy. But it's also not very dense. So when you lose actual fat, you're losing inches. When you're losing water, you're losing pounds.
Like the size of a pound of butter.
Right, right. Because butter is primarily fat. And it isn't very heavy. You know, like the cream rises to the top of, you know, the milk. So what you're going to do is drop the carbohydrate, get, you know, metabolize all that out, kind of get back into fat burning mode. Take a note and say like, okay, State Fair is over, or whatever you indulged in. And then living out the healthy dietary habits learned throughout the weight loss phase. If you really enjoyed taking, you know, making your own healthy alternatives, you know, like, oh, I was, you know, really liked bringing a salad every day to work and all the different fresh fruits and vegetables that I was eating, and then you return to takeout, you know, try to really ingrain these. And this is more like a jump start. This is like really learning how to live your life in a healthy way. And not necessarily just for weight loss. Truly, this is not a bikini competition. It's really about all those diseases and health states that we really want to avoid. And I'll tell you, about 80% or more of the common illnesses that we suffer in our country, a large amount of them are really avoidable through lifestyle, diet and lifestyle. In the bush of Africa, nobody is needing triple bypass surgery or needs to be on cholesterol-lowering medication. Once you are off HCG, this is the time. If you want to go out and exercise your heart out, go ahead. Just be aware, what we talked about, the same with reducing. Might your weight fluctuate a little bit when you're exercising? It might. And understand that it will stimulate your appetite, because you are using energy and you need actually more energy to grow and develop more muscles. So eat smarter. Same way that you ate when you were trying to lose fat. upping the protein, upping the healthy carbohydrates, sticking to unprocessed foods. So really be your best bets. Stabilization phase, this is, whoops, sorry. The stabilization phase, so this is what we talked about, you know, if you start one weight, that you really want to stabilize at a certain weight. 2 pounds we can lose overnight, no problem. You would be amazed at how quickly 2 pounds turns into 10 to 15 pounds, and that is a lot harder to lose. So really being very aware of yourself and nip it in the bud before it gets into a problem. And I'm hearing this a lot from people. Well, the holidays are coming up, and I know, you know what, the holidays come up every single year, and you can't use that, and I know it's really easy to do, I know. And my family knows I like brownies. And my mom thinks it's a special treat to have lots of them. And yeah, it's hard to say, don't make brownies, Mom. Don't make them. But you can't use that as an excuse to overindulge and then lose the same 10, 15 pounds. So that's what Dan was talking about too with the yo-yo dieting. And then the maintenance phase. You don't want to be one of those persons lost it, regained it, that you're going to go through and did we already do this slide? I'm sorry.
Yes, we did.
Well, I have more to say about it apparently. I'm sorry. Exercising, eating healthfully. So this is one of our patients. She did 2 rounds of HCG. She did take each round was about 6 weeks, and she did take a break in between each round, and I believe she lost about 40 pounds. And you can see where she primarily lost it, in the middle. She's a volleyball player. She really had pretty well-developed arm muscles. She didn't lose a lot. She might have lost, she didn't carry a lot of fat in her arms. She didn't lose it. Primarily the abnormal storage fat is what you can see. So I'd like to thank you, and if anybody has any questions or concerns, you can go ahead.